One of the big fears that I've come across working with lots of pregnant mamas is tearing during birth. In this video, we're going to talk about how to prevent tearing as best as possible. My name is Bridget, and I'm a birth doula, childbirth educator, and a mama to two and a third on the way. And if you are new, don't forget to subscribe and hit the bell so you don't miss out on any empowering educational videos that come your way. So I've given birth twice, once in a hospital and once at home. And my first birth, I had a first-degree tear, which was very minimal. It was a vaginal abrasion, not on the perineum, and I only received stitches because I was in a hospital setting. I know that if I was at home, my midwife probably would have told me to just stay in bed, rest for several days, and I would have healed up just fine without needing any stitches. I gave birth to my second baby at home, and I didn't tear at all, so I'm going to share with you what I did to help prevent serious tearing or tearing at all. And these are all things that I'm doing now in my third pregnancy to prepare for my third baby. Number one is to create a mind-body awareness with your pelvic floor during pregnancy. This is something that you can do right now. So many women have a really hard time connecting with their pelvic floor, and this can be detrimental during labor because mamas don't know where to push or how to push. So one of my favorite ways to connect with the pelvic floor is through core breathing. I do this all the time in my 6-week prenatal fitness program, which is designed to specifically prepare your body to have a vaginal birth. You can check out that fitness program linked in the description below. Now, to do this core breath, you need to inhale, and as you inhale, you should feel your pelvic floor release and lengthen, as well as your abdominal muscles relax. On the exhale, you're going to blow out of your mouth while you pull up your pelvic floor and you draw in your abdominal muscles together. You'll practice this breath for 1 minute. And this mind-body connection helps so much with feeling your pelvic floor, especially on the release, because your pelvic floor must yield in order for baby to pass through it. Women hear so much, you need to strengthen your pelvic floor, do your Kegels. But the reality is many women actually have a tight pelvic floor or tension and imbalance in part of their pelvic floor. And this can make it hard for baby to move through the pelvic floor easily when they're being born. So having that mind-body connection and being able to actively relax and yield your pelvic floor as you push is a game changer. Contrary to popular belief, you're not actually pushing your baby out with your pelvic floor. Your uterus is pushing your baby out, and you can use your abdominal muscles to assist in that pushing action. And so this core breath is actually helping you strengthen those abdominal muscles safely in pregnancy so that they are strong enough to help facilitate your uterus pushing down on your baby during birth as well. Now, if you're like, I don't feel my pelvic floor at all, that's okay. In my prenatal fitness program, this is something I go more in depth on and something that we practice throughout the 6-week program, like I already mentioned. So if you need more support, it's time to start the program now. The second way to prevent tearing is to forego the epidural. An epidural increases the risk of severe perineal injury, and this could be due to multiple things. It could be that first-time moms are more likely to get an epidural than women who've given birth before, and your chance of tearing is just higher as a woman who has never had a vaginal birth before, but not impossible. It could be that epidurals are associated with increased risk of having an instrumental birth, like with forceps or a vacuum, that also increases the risk of perineal lacerations. It could be that the lack of feeling from the medication in the body inhibits mama from knowing how hard to push and when to start and stop. Or it could be that epidural usage prevents mama from changing positions as much as she's pushing, and she ends up pushing flat on her back, which is actually working against the design of her body that would naturally support birth. So there are multiple reasons why an epidural might increase the chance of tearing in childbirth, but when you birth without one, you will feel the sensations in your body and know when and how hard to push. The likelihood of needing an instrumental birth goes down, and you're more likely to move and change positions that best support the birth of your baby. Regardless, not using the epidural might help you prevent tearing as you push. If the thought of an unmedicated birth just absolutely terrifies you, I invite you to step into a more empowering birth journey and check out the free mini birth class that I have linked down below that teaches you what you need to know for a happier, healthier, and easier birth. Now, number 3 is to push with your body's urges. At the end of labor, your body has a natural instinct to birth your baby. It's called the fetal ejection reflex, and this reflex is like a sneeze that you can't get away from. Your body feels it building, and then all of a sudden you're just doing it without telling it to or not to. And this is when you want to start pushing. This often happens when the cervix is fully dilated to 10 centimeters, but it can come after a rest period once the cervix has fully opened. Just because your cervix is dilated does not mean your baby is low enough in the pelvis to trigger that fetal ejection reflex. Waiting and listening to your body is going to make the pushing stage much easier if your body is helping you do this. Now, sometimes a fetal ejection reflex can be felt with an epidural, but it just depends on the strength of the epidural. So if you do have an epidural, you can do something called laboring down. And this is when you wait after being 10 centimeters dilated for baby to move further through the birth canal, closer to the vaginal opening before you start pushing. Number 4 is to birth off your back. When you're birthing on your back with your legs up in the air or pulled tightly up to your chest, you're actually closing off the pelvic outlet, the space that baby needs to come through in order to be born. The vaginal canal is also pointing upwards in this position. What does this mean? It means that you have to push even harder to get baby through the space, which puts more pressure and power against these already stretched tissues of the vagina. In my first birth, I gave birth on my side, and my second, I gave birth in a lunge position. If you want other positions that open the bottom of the pelvis and assist in your body's natural ability to birth your baby, you need to take the Built to Birth course, which is linked below. And number 5, don't purple push or push at all. Purple pushing is a technique often used in the hospital, also called the Valsalva maneuver. A provider will tell a woman to take a deep breath in and then push as hard as possible for as long as possible, usually holding her breath for 10 seconds and then repeating that for 3 rounds in one contraction. And this puts an incredible amount of pressure on the tissues of the vagina and is linked to perineal laceration. But sometimes this pushing is the only effective way to push because mama has limited sensation and she's birthing on her back. So what might be better is getting mama into an upright position like we've talked about, and then from the beginning, opting out of that epidural and encouraging her to listen to her body's natural urges. If you are unmedicated in an upright position, feeling the fetal ejection reflex, you don't necessarily need to push at all. Doing small, quick breaths like this, or slow vocalizations, ooh, can actually help your body do the work without you consciously adding power behind what it's already doing. If you do need some direction when pushing, be mindful that you know your body best. Take that breath when you need it. I teach you how to breathe your baby out in the Built to Birth course. So again, if you're feeling anxious about all of this or any of this, sign up for that course and you'll get so informed and feel so empowered. So that wraps up this video with my tips for avoiding tearing while pushing. Let me know if you have anything else to add to this list in the comments below. Thanks for being with me in this video, and I will see you in the next one.